How does a hospital measure the value of a technology investment? Is it based on patient satisfaction? Joe Stewart loves to run. Just 3 weeks after radical prostate cancer surgery, Joe ran the Chicago Marathon. Today, Joe Stewart is cancer-free. Just 72 hours after major pelvic reconstructive surgery, Carrie O'Connell was back on the playground with her children and back to being a happy and healthy full-time mom. 16-year-old Brittany Nelson underwent open-heart surgery to repair a congenital defect. A few short days later, Brittany was back to simply being a teenager. How does a hospital measure the value of a technology investment? Is it based on clinical efficacy?
Patients will ask me, is the DaVinci prostatectomy a better cancer operation? And in my opinion, and in my own experience, it clearly is.
A little over 2.5 years ago, I was diagnosed with early stages of prostate cancer. One of the options I discovered in my research over an 8-month period of time was there was a DaVinci robot device that was used for laparoscopic computer-assisted surgery for a complete radical prostatectomy. The more I researched that subject, the more I knew that that's the approach that I wanted to use. It really eliminated the risk factor. It was very precise. It was also nerve-sparing potential. All those kinds of things that for someone who at 56 years of age had never been hospitalized was very comfortable with. I have not taken a Tylenol during any part of this process. It was pain-free. I was out of the hospital in a day and a half. Literally 2 weeks into my recovery, I was building birdhouses in my garage just to pass the time so I could get to the point where I'd be released to go back to work. I went to work in 4 weeks' time after surgery, completely dry, continent, and with no restrictions at all.
We need to listen to what the patients say. The patients do not want heart surgery with a big incision. Now, if they're given no other option, then they'll say, okay, I'll take it. I'll take the big incision. But the cardiologists are basically coming up with catheter-based treatments that are not as good as our surgical treatment. But because they can do it through a puncture wound and totally minimally invasively, the patient takes the inferior treatment rather than the gold standard treatment by the surgeon. So we need to listen to we haven't been listening to what the patients say. Now, if we can give them the gold standard surgical therapy through 4 holes in the chest, then what I've found is they say, well, I'll take that rather than a catheter-based closure of an ASD or a catheter-based mitral valve repair.
Robotic surgery, this minimally invasive surgery, was perfect for me for a couple of reasons. It fixed the problem in a way that seemed to be more permanent and sure than a stent. It addressed an issue that might have been life-threatening, and it gave me a different option than full open heart surgery.
How does a hospital measure the value of a technology investment? Is it based on economic return?
The basic financial structure of hospitals and healthcare systems is based on a very high fixed cost to variable cost model. And that means that over half of our costs are fixed. And we are trying basically to manage against the variable cost structure that can change with volume. But we have to cover a very, very large fixed cost base. What we've done at our health system, at Henry Ford Health System, is to try to drive surgical growth, because the marginal improvement on a surgical patient is significant. We tend to make probably more than half of our profitability from surgery. The opportunity for us with the robotic procedure has been significant in terms of revenue growth, because we've done over 1,300 cases using this technology. Historically, if we looked at our growth curve for urologic procedures, it was pretty flat. So the opportunity for increased revenue, increased market share, increased surgical volume, which is very profitable generally for healthcare organizations, is very substantial. We're very pleased with the return on investment. As I mentioned earlier, we were not confident going in that we would see a significant return on investment. We felt that it was worth the risk, and we wanted to try it, and we wanted to see what kind of results we would achieve. But as it's turned out, we have had a very positive return on investment.
How does a hospital measure the value of a technology investment? Hospitals today invest in new technology in order to achieve patient satisfaction, improve clinical outcomes, and generate a positive return on investment. Based on these criteria, the DaVinci Surgical System is a requisite investment for any hospital's minimally invasive surgery initiative. The DaVinci system is the most advanced surgical platform available in today's market. The DaVinci system consists of an ergonomically designed surgeon console and a patient-side cart with 4 interactive robotic arms, one to hold and position the high-resolution stereo endoscope, and the second, third, and fourth arms to control high-precision, fully articulated endo-wrist instruments. While seated comfortably at the DaVinci console, the surgeon views a magnified, high-resolution 3D image of the operative site. Powered by state-of-the-art robotic and computer technology, the surgeon's hand movements are scaled, filtered, and seamlessly translated into precise movements of the endo-wrist instruments. The net result is an intuitive interface enabling unparalleled precision, dexterity, and control. Intuitive Surgical is the worldwide leader in robotically assisted minimally invasive surgery. A strategic investment in the DaVinci Surgical System will allow hospitals to set new standards in patient satisfaction, clinical outcomes, and economic return. Intuitive Surgical is driven by a single vision: to extend the benefits of minimally invasive surgery to the broadest possible base of patients. How should a hospital measure the value of a technology investment?
I thought, surgery is supposed to hurt, but the tape and the IVs hurt the worst.